The American Academy of Pediatrics recommends that all children receive an autism-specific screening at 18 and 24 months old. Claudia Salisacala explains the MChat, one of the recommended screening tools for toddlers, which can be administered to a child as young as 16 months.
Developmental screenings should be a part of every well baby visit. Screenings monitor a child's healthy development. The earlier a delay is detected, the better the prognosis for the child. If there are concerns about autism, your pediatrician may bring out a screening tool called MChat, also known as the Modified Checklist for Autism in Toddlers. It's used with children 16 to 30 months old to determine their risk for autism spectrum disorders.
But it's a way of early identification long before one's concerned about giving an actual diagnosis. It is definitely a screening tool. It's not diagnostic.
The Ivaro family of Visalia was concerned about the development of their son Jace. 1 year ago, he was referred by his pediatrician to the Central Valley Regional Center and given the MChat.
I think we were initially just wanting to know if he really was behind in his development compared to other kids his age. We wanted to get some answers as far as if he did have autism, if there was a chance that he did have autism. We found out that he wouldn't be diagnosed until he was 3, but that there were things that we could be a part of, programs that we could join.
The MChat is a 23-item pass-fail questionnaire that looks at behavior. Of the 23 questions, 7 are considered critical. Some examples: does your child take interest in other children? Does your child play pretend? Does your child respond to his or her name when you call? If you point at a toy across the room, does your child look at it? A child is considered at risk for autism if the answer to 2 or more of the 7 critical items are failed, or if any 3 answers to the total 23 questions are failed.
It's difficult to diagnose autistic disorder in a very young child. Technically, the diagnosis of autistic disorder, there are supposed to be some signs present before age 3, but the younger the child is, the more difficult it is to differentiate the characteristics of autistic disorder with other disorders.
Families can be referred to CVRC through pediatricians, child care providers, social workers, or they can refer themselves. Usually, referrals are made in order to monitor a certain characteristic, such as a language delay.
We go ahead and review them in their 6 developmental domains. Even if they're just concerned about language, we look at a variety of areas. And we have a nice big room in there, and the longer the kids have to kind of unwind and get comfortable with what's going on, probably the more typical their day-to-day behavior comes out.
The MChat includes an assessment by a multidisciplinary team. Members of that team will look for characteristics of autism in the toddler.
We all kind of work together. We're a multidisciplinary team, and so based on what I see, I can tell our team, we might want to take a look, we might want to take an MChat and take a look at this child. He's got some peculiar behaviors.
The team also talks with the family to hear its concerns and to identify any characteristics that the parents might have noticed.
Now, Mom, if you were to point across to something or point up at the sky, do you think he would look at your point and in the direction?
Initially, when we came here a year ago, I don't think he would have at all.
The nice part is our service model is that families don't have to have a diagnosis of autism. They just have to have symptoms that are of concern, and that's what we identify. And usually within a couple of weeks, the ball gets rolling, and this is the entry point for the service model.
The MChat scoring method increases the total number of children who are identified to be at risk. Some children who screen positive on the MChat will not have autism.
It's better to over-identify than under-identify. I think at this point we would rather have people identified and treated rather than have them missed. For a young child, the brain is still developing, it's still plastic. The more we can get behavior intervention to make alterations to that, the better. We're seeing amazing positive results with these early interventions.
In fact, 1 year ago, the MChat found Jace at risk for autism. Now he's not.
We're one of the lucky ones, I feel, because we started so early. He just recently had his last psych evaluation, which points out that he won't be diagnosed with autism right now, that he did get diagnosed with a pervasive developmental disorder, which is PDD.
And you've seen that, just that tremendous difference in the way he plays with other kids from interacting with kids and being in the play group?
Absolutely.
Jace's parents attribute his developmental progress over the past year to early screening and early treatment. I'm Claudia Solis Alcala for 0 to 5 in 30 minutes.
Thanks, Claudia. Contact the Central Valley Regional Center for more information on the MCHAT or any other autism-related assessment. The number for the Visalia office is 559-738-2200. In Fresno, you can call 559-276-4300.
This program funded in part by First 5 Fresno County. At First 5, we focus on the first 5 years of life. We fund programs and services that better the lives of children in Fresno County.
Additional funding from First 5 Tulare County, changing lives and building futures. Because it's all about the kids.